guys, it's Danielle with Pure Root Wellness, and today's topic is going to be supplemental knowledge. Just kind of talking about a basic framework in regards to understanding, the role of supplements within your dietary kind of intake, and kind of looking at what the FDA says about supplements, how to choose good quality product, and giving kind of a list of some good quality brands that I would recommend as far as supplements go. So the definition of a supplement by the National Institute of Health and the Office of Dietary Supplements says that the purpose is intended for supplementing the diet. This simply just means that you need a good solid framework of nutrition and dietary intake, and then anything that you're lacking or deficient in, that's where the supplements come into play. These supplements need to contain one or more dietary ingredients, and they are actually intended to be taken by mouth. We're not talking about ointments and poultices and kind of skin treatments. This is more oral medication that we're kind of referring to. Supplements need to be labeled as such, a dietary supplement, on the actual label themselves. That's obviously regulated, by the NIH itself to say that's what it needs to entail and say on the product. And supplements are regulated by the FDA as a food product, was kind of interesting. The supplements are obviously not oversought and regulated similar to what we would see from a pharmaceutical standpoint in regards to the testing and the extensive research, for reasons that we can talk about in another podcast. But truly, it's just good to know that the FDA is looking at this more so as a food product or supplement versus an actual medication on the same kind of wavelength as the pharmaceutical medications that we all know very well. Drug manufacturers may claim that their product will diagnose, cure, mitigate, treat, or prevent diseases. Such claims may not legally be made for dietary supplements. Typically, dietary supplements will fall under three claims. The first would be a health claim, which basically just kind of describes a relationship between food components, or a dietary supplement ingredient, and then reducing the risk of a disease or a health-related condition. A nutrient content claim just describes the relative amount of nutrients or dietary substance in the product. And then a structure or function claim is a statement describing how a product may affect organs or systems in the body, but it really can't mention any specific disease. And just kind of a side note, this does not require FDA approval under structure or function claim. So you may be thinking you're getting a product from a manufacturer that's well tested and regulated, but in reality, if it falls under the strong structure or function claim, that may not be the case. So really understanding what you're getting, the product you're getting, what kind of regulatory bodies are looking over the product that you're consuming, is very important. And unlike kind of drug products, there's obviously no provisions in the law for the FDA to approve dietary supplements for safety or effectiveness before they actually reach the consumer. So once a dietary supplement is actually marketed, the FDA has to prove that the product is actually not safe in order to restrict it or remove it from the market. So it's interesting. It's almost like they've got to prove that it's not okay to use before you can prove that it is okay to use. So again, just being cautious and aware, and really kind of doing your homework is kind of the take home of this. I don't want to deter anybody from taking good quality, pure supplements, but I want you to be aware that not all supplements are created equal for these reasons alone. Safety. It's obviously difficult to determine the quality of a product from its label. That's where kind of the homework comes into play. That's where someone like myself, or a naturopathic doctor, or a functional medicine doctor, we enjoy doing the research and finding the good quality products that we know will provide consistent results for certain health ailments, or functioning processes in the body to help optimize your overall health. The degree of quality is dependent on the manufacturer, the supplier, and the actual production process. So, it's again very important to know where this product is coming from, who's the manufacturer, and kind of the purity of the product. Dietary supplements are not required to be standardized. So the standardization is a process that manufacturers may use to ensure that each batch is consistent of their product. Obviously, in some cases, the standardization involves identifying specific chemicals that can be used, to the manufacturer a consistent product. That means every single product, every single bottle is exactly the same as the next or somewhat close to the same. This standardized process can also provide a good measure of quality control. The good manufacturing practices really are we call it the GMPs. This includes basically requirements for preparation and storage. That's kind of one of the regulatory bodies that we've been seeing, that will give you comfort in knowing that this is a product that's been prepared appropriately, stored appropriately, and there's some form of standardization within that process. But interestingly enough, dietary supplements are not required by federal law to be tested for safety and effectiveness before they go on the market, kind of what I talked about prior to. So the amount of scientific evidence available for various supplements ingredients really varies widely in the U.S. There are 3 groups that do test for supplement quality. The NSF, which is an independent public health testing laboratory. This entity also kind of tests bottled water and commercial products. The Consumers Lab, they check for identity, strength, purity, and kind of the pharmacokinetics that are involved in a lot of the supplements. And then the USP, which is the United States Pharmacopoeia, it's where they test what it contains, what the supplement contains, what's on the label is, the stated potency, and checks really for any kind of harmful contaminants that may be in the product. So just so you kind of know, if you do see the words, standardized, verified, certified on a supplement label without the seal from really one of these 3 groups or entities, really don't get that excited. These words are not, regulated and do not guarantee that the product quality is consistent. According to the NIH. So, you got to kind of take it with a grain of salt and again, really do your homework, know where the product is coming from, know how these facilities and manufacturers are processing, and kind of trust that they're going through the necessary steps and hoops to make sure that the product you're receiving is safe. So how to take supplements. Obviously, as always, with all of my kind of podcasts and information that I kind of pass on, always talk to your PCP, your ND, your functional medicine doctor first, your naturopathic doctor, before you kind of start incorporating all of these different type of supplements or herbal, kind of entities. But, really typically the general rule is taking a multivitamin or a mineral with food. You'll generally get less upset stomach and you'll receive better absorption. Ideally, it would be best to take water-soluble vitamins on an empty stomach and then fat-soluble vitamins with food. But again, if you're taking a multivitamin, that's kind of challenging. It's better to err on just having some food in your stomach and then taking that multivitamin, despite kind of the water-soluble, fat-soluble vitamins that are kind of incorporated throughout the entire multivitamin. Pay attention to the dosages based on body weight. Not all multivitamins are a 1 a day. Some require you to take, 2 in the morning, 2 in the afternoon, 2 at night. It just kind of depends on your health goals and what, you're looking to supplement as far as a deficiency standpoint. But just know also that, coffee, caffeine, pop, all of these things can interfere with the absorption of some vital vitamins and minerals. So being cognizant of that as well. And I guess the big picture is too, if you're deficient in one vitamin or mineral, remember that there's always synergy between all of the nutrients in the body. So you may be lacking one mineral or vitamin, but that mineral is also dependent or works, as an adjuvant with another vitamin or mineral as a coenzyme, or as they make each other work better for better absorption. Just know that if you're deficient in calcium and you take a bunch of calcium, you may start lacking in other nutrients as well in the body. So having that kind of big picture, holistic kind of picture when it comes to taking vitamins and minerals is very important. So this personally is a list of trusted supplements and herbal brands that I have looked into throughout the years. The first one that I always talk about is Pure Encapsulations. This I've investigated for a while. I'm someone who has the ability to prescribe Pure Encapsulations for family, friends, people who are looking to use supplements to optimize their health. This really is a practitioner channel brand. It is, registered with the NSF, GMP, free of allergens, non-GMO, high quality product. They truly have pretty much everything you could think of and then some. They really go above and beyond as far as the research aspect goes for supplements. I've been truly very impressed with every product that they've been able to provide. One caveat is, and I noticed actually during COVID, some of even just their simple multivitamins were difficult to obtain just because of, products coming in and, plants possibly being shut down and things. So there were some issues with back orders throughout kind of the whole COVID period, but I think they're starting to kind of work out those hiccups now. But truly this brand, I couldn't speak highly enough and would encourage, anyone to at least try some of their products if they're looking to supplement from a vitamin or a mineral aspect. Now Foods, very transparent about their certifications, USDA organic, non-GMO, again, GMP practices. Thorne Research, they have their own dedicated lab, a huge team of like scientific advisors, again, registered in a GMP facility, high purity, good absorption. Life Extension, this has really been a staple of quality for over 40 years. They operate, again, in their own NSF registered GMP facility. Vital Nutrients, really, they're good at basing a lot of clinical research. Their blends are based on a lot of clinical research, I should say, and products that really address specific kind of health concerns, which is important. Herb Farm, I talk about this more in the herbal podcast as well, but herbal extracts, tinctures, this really, they look at really good organic, non-GMO source through like ethical guidelines from local farmers around the world, which is pretty cool. So definitely, if you're looking more from the herbal supplementation, that company, very good quality product. Gia Herbs, standard for plant-based medicine for over 25 years. The ingredients are actually sourced from a mountain in North Carolina, which is pretty cool. You're kind of staying in-house from a USA kind of standpoint, which is always great. Douglas Laboratories really focus more on kind of sports nutrition, but again, good quality product. Garden of Life, organic, non-GMO, whole food ingredients. So if you're looking something more from like a whole food kind of supplement standpoint, Garden of Life is really where you would want to be. Jarrow Formulas, large category of supplements, fully certified, and then Standard Process, which is high quality. The only thing with the Standard Process, I was reading, would maybe be like a poor choice for people with kind of food sensitivities. So, just kind of looking at the basic framework of choosing a good supplement, knowing which supplements are going to optimize your health, I think is truly important, but knowing that you really have to be careful. You can't, just go online or walk into, your grocery store or, local pharmacy store, and kind of just find products that you think are getting good quality and good absorption. You really need to do your homework a little bit and make sure that what you're putting in your body is actually going to help you and not just waste your money in addition to that. So here are some references, and short and sweet, but that's kind of the basis for supplement knowledge. I hope this helped a little bit, and I hope everyone is doing well and be well. See you guys soon.